So what we've tried to do is highlight some areas where we could run and help run pilot projects. So, for example, I've been talking to a former classmate of mine who is the Director of Public Health for Lagos, which is a state of around 30 million people in Nigeria. So Nigeria is a federal system. And they of course, have already high rates of prostate cancer and rising. And so what we're doing is we're planning and hoping to get funding for some pilot projects where we do a sort of broader health screen test. So we're not just testing for PSA, but testing for, as I said, hypertension and diabetes are particularly easy things to test for. It doesn't take long, it's cheap. And hooking it up to enrolment in insurance schemes, which they're in the process of setting up in Nigeria anyway. So there's a sort of stick and a carrot. Carrot and a carrot, really, the insurance scheme. Because one of the problems, if you're diagnosed somewhere where there's not comprehensive health coverage, you've then got the issue of how you pay for treatment. But if you hook up, for example, an early diagnosis program with enrolment in an insurance scheme, if you do need treatment, you're insured. Whereas if you have a system where you present, which is kind of the norm in a lot of the world, and then you have to self-fund the consequences, that's a real disincentive for people to come forward. They really don't want to incur unwanted expenditure. So we think schemes like this, as exemplars of the sorts of things that you could do, will be very important in the next few years to point the way to how other countries could do the same thing. There's a growing middle class in Africa. There's growing money in Africa. So there are the resources there to do it. And I think we need to work with people who have the ability to implement change in order to do this. So we're talking to people like UICC, the World Health Organization, around how we might progress this.